So, good evening, everyone, and welcome. My name is Nina Uzoigwe, and I've had the privilege of serving as president of TSMA for the past year. On behalf of our entire leadership team, thank you all for taking the time to join us for another session of our NextGen Heart series. This series was created again to connect pre-medical students and medical students to distinguished physician leaders who have not only achieved excellence in medicine, but have also shaped the future of healthcare through leadership, innovation, mentorship, and service. Our hope is that these organic conversations will provide you practical insights and remind you that there are many pathways to being able to make an impactful moment in medicine and lifestyle in medicine. So tonight, we are truly honored to be joined by Dr. Higgins, President and Chief Academic Officer of Rush University and Senior Vice President, as well as Chief Academic Officer for Rush University System of Health. Dr. Higgins is an internationally respected surgeon, physician scientist, and academic leader whose career has been defined by excellence in patient care, research, education, and leadership. And prior to joining Rush, he served as surgeon-in-chief at Johns Hopkins, as well as president of Brigham and Women's Hospital and executive vice president of NextGen Brigham. As a graduate of Dartmouth College, as well as Yale School of Medicine, Dr. Higgins has led some of the nation's most prestigious surgical and academic organizations, authored more than 200 scientific publications, and dedicated his career to advancing research, health equity, and the education of future physicians like all of you guys on this call and all those that we see in the recording. His lifelong commitment to developing the next generation of healthcare leaders makes him an especially fitting guest for today's conversation. So, Dr. Higgins, thank you so much for sharing your time and wisdom with us. And we're very grateful to have you on this call. So, everyone, please join me in welcoming Dr. Higgins to this virtual platform.
Well, thanks, Nina. Really appreciate the invitation and the opportunity to spend some time with bright next generation of healthcare providers that is really part of my mission and really honored to be here. So thanks so much for the invitation.
Thank you. Again, we want this to be a very organic conversation. So as I'm going through some of these questions that we have put together for this meeting, feel free to drop any questions, comments, concerns you might have in the chat. Again, this is supposed to be an open, organic space just to have a very flowing conversation. But we'll start with this first question that we have here, Dr. Higgins. So you've built an extraordinary career as a surgeon, an educator, a researcher, and healthcare executive. And looking back, what first inspired you to pursue medicine and what experiences ultimately shaped the person that you are today?
Well, I was fortunate to grow up in an environment where my family had distinguished themselves. And my dad was a doctor, and so we had this idea that we were going to pursue uh, academic activities in medicine or law. And unfortunately, when I was five, my brothers were three and one. My dad was killed in a car accident,
Mm.
and my mom was left to kind of raise three rambunctious boys. And so we moved back to upstate New York with my grandparents, and my grandfather was a lawyer, and they instilled in us the idea that in order to excel in the current environment, that was 1965, that we had to study hard, work hard, and kind of outpace those who are our contemporaries, particularly because they were in the majority. And as minority young people, we had to do more to achieve the goals that we wanted to achieve. So I was fortunate to be able to do that. And we ended up in academic environments that were pretty solid. We were so bad though. My mom said if we didn't start behaving, then we had to she was going to send us to military school.
Oh, wow.
Damn if she didn't do it. And so we ended up at this place, the Albany Academy, which was ROTC at the time, three African American boys, primarily because she thought we needed the discipline. And she
Mm.
was working full time. And so, as it turns out, I think it was a pretty good prescription for success. And my brothers and I all went to Ivy schools and had great careers, primarily because of the work that my grandparents and my mom did to get us there. So that was the foundation upon which I always had this idea I wanted to be a doc, but
Mhm.
didn't really understand what the amount of work that was necessary. Went to college, played sports, and until I had a career-ending knee injury, did I learn that I had to do more academically in order to be successful to get into medical school. Long story short, I took organic chemistry, and somehow it's my best grade ever. I
Wow.
enjoyed it, and that was the kind of the that opened the door, and
Mhm.
then ended up in New Haven at Yale, which was a great place, and I enjoyed immunology and surgery, and ended up wanting to be a transplant guy. And so I ended up doing well in medical school and ended up at University of Pittsburgh as a transplant wannabe. And
Mm,
initially I wanted to be a abdominal organ transplant, but I ended up in the cardiac field and was enamored with that, and the rest is history. So I went to Pittsburgh and did my training there, and my fellowship back in New Haven, and then in the UK for a year doing transplant, and that's how I got my career started in 1993. So that's a kind of a long story, but it speaks to the idea that number one, I had instilled in me the need to be successful academically and to work hard, but also to follow my vision for having an impact. And I was fortunate to then come back and go to great places and have a great career. And I'm very fortunate to be there.
absolutely. Thank you so much for being so vulnerable and sharing those key pivotal moments of your career, especially the dynamics with your grandparents and your mom, and just being able to still uphold that legacy that your family has really instilled in all three of you, you and your brothers.
Yeah.
And so I guess saying that, was there a particular moment or like opportunity or mentor or challenge as you were talking about your story that fundamentally changed your trajectory in your career that you could talk about or elaborate on right here for us?
Well, I think the role of mentorship and sponsorship was played out early.
Hmm.
I was fortunate to, if I worked hard and I studied, that I thought would be enough. But in fact, people who gave me opportunities and opened doors was the key to my early career success. If it had not been for my professor at Yale, who was interested in transplantation, taking me under his wing, I might not never have been able to get to a place like Pittsburgh. Or the people at Pittsburgh who helped me early on in my career avoid the pitfalls of and mentored me in the transplant space.
Hmm.
And then all the way along the line, the people at Henry Ford who gave me my first job and paid for me to go to England with my family to get trained, or the people like Chris Ellison at Ohio State, who
Oh.
took me under his wing and offered me the opportunity to lead the cardiac surgery program at Ohio State, or my dean here at Rush, who took me under his wing and helped me learn how to be a department chair. Each
Mm.
one of those people invested in me, and in return, I gave back as much as I could give to be successful. And I think that's what the difference is between mentorship and sponsorship is. The mentors treat you like a parent or a loved one who pat you on the back and say, atta boy, atta girl. But the sponsors who have been most influential in my life said, we're going to give you as much support as you can get, but in return, we want you to succeed. And their expectation is, as a sponsor, that I would succeed. And in fact, I've been fortunate to, with that kind of pathway, been able to do some pretty good things. And I get a lot of hard work, a lot of good fortune, and obviously that sponsorship has been critically important.
That's fantastic. Feel like you've shared so many gems of wisdom here. If there's anyone who wants to drop any questions in the chat or go off mute, feel free to. Otherwise, we can move on to the next question, but I'll leave a slight pause for anyone who might be interested.
I think there's a hand up there. Oh no, never mind.
It's all good. Um, Great to be here. Thank you so much, Daniel. Really appreciate it. Yes, that's a really good question. It's also leading up to our next question here too. I guess looking back at your journey, what advice do you have for pre-medical students and medical students on the call about how to sort of really look at sponsorship and also get similar positions that as you just so explained as well just a few minutes ago?
So I guess you have to really want feedback. A lot of people don't want to be criticized and or have constructive feedback, but I think it's a gift.
Mm,
It empowers you to understand how other people see your performance and allows you to modify your behavior or work harder in a certain area or redirect your attention So I seek feedback on a regular basis. I've been a big fan of kind of 360 degree, but I also have a regular meeting with my boss, even now.
Hmm.
And I talk to him and I ask, what can I do better to meet your expectations? Now, sometimes you can't accomplish all of those things, but the fact that you ask about it makes a world of difference, I think. The second thing I think that you have to be able to demonstrate is equanimity under pressure. In other words, you've got to be pretty composed and calm, and particularly because healthcare is tough work,
Yeah.
and there are very challenging circumstances that we're all facing right now. So you've got to be able to manage your emotions and your temper and your direction to serving the greater good, rather than getting into squabbles or battles with people who are naturally going to kind of trying to get under your skin. You just got to kind of move beyond that. I think that you have to be able to demonstrate that you can accomplish certain tasks. I guess effort without results is not enough.
Hmm.
You've got to demonstrate that you learn from your experiences and can be accomplish your goals. So, and I think the last thing I think you have to really be familiar with your own limitations. Uh, there's some things that I'm not good at, and I recognize that, and I often ask for assistance in those areas. So you have to have some emotional intelligence to know where you're limited and where you might need help. And I think that helps you get the appropriate attention when you need it. So those are some of the things that I think help develop a leadership profile that lets you excel and be recognized by others as a servant leader.
Absolutely. Servant leadership is a key element that we all strive to become, honestly, and being able to hear
Right?
about getting feedback from your superiors and also being able to sort of have that self-awareness about your emotional regulations and your emotional intelligence is so, so very important. I have a lot of anecdotes I can speak to that as well. And it seems like Daniel, that question was answered. So hopefully, if there's anything else that you want to ask, feel free to. I'm seeing in the chat that we have a question from Alma. So how did you prioritize all of your responsibilities while you're in school, and how may have that changed when you transitioned to clinical practice and leadership?
Yeah, I do think you have to prioritize. You know, I was a college athlete until I blew my knee out. And then I realized that I had to focus on my academic activities, organic chemistry. And then I had to kind of get trained. And so you have to be dedicated to it. You've got to be passionate about it. I actually loved being in the hospital. I loved taking care of sick patients. I really enjoyed that work, and because I thought it was impactful. You know, I started my career in Detroit, and you know, it was in the middle of downtown Detroit. As a
Mhm.
black man in an environment like that, I really had an identity in that space because I was the first one in that space to take care of patients and create the transplant program at Henry Ford Hospital. Um, I thought it was a fantastic opportunity to 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 solve some major problems from a cardiovascular perspective in an underserved community.
Mhm.
I think we created the first Medicare approved transplant program in Detroit. They had kidney programs, but didn't have cardiac or lung transplant. So that was a niche that I thought was pretty special. And then we had a lot of people come to us because we had great results. And we did over 175 transplants in a relatively short period of time. And it was all about excellence, high quality care that people did not expect. So I was proud to be able to do that work, but it was a lot of hard work, a lot of late nights and but yet well worth it.
Thank you so much. I'm also want to ask you a question about the publication that you've shared, Opening the Door. You and your team really write about the importance of creating pathways in cardiothoracic. next generation of students. And one of the themes that really stood out to me was the distinction between opening a door and creating an environment where people truly belong. And so, as an institutional leader, what have you learned about being able to build cultures where every trainee has the opportunity to thrive and grow?
Well, we're lucky to kind of have a platform here in Chicago at Rush. It's kind of a teacher practitioner model where we're trying to commit to the training of the next generation of healthcare professionals in an academic setting with research and excellent clinical care. But giving something to the community that we serve to try to
Hmm.
eliminate those disparities. And I'm proud that Rush has got a long history of doing that. It starts almost 180 years ago when Rush Medical College was chartered in the 1800s. And I think that being part of that mission, that health equity mission, and eliminating those disparities has been very impactful. And it leads to our reputation of looking out for those who have not historically had those resources dedicated to them. So it's an exciting time to kind of be here. Our health equity mission and eliminating disparities is having an impact. And from a reputational standpoint, a number of students now come and gravitate to Rush because they want to get trained in that space and they want to champion that health equity mission. So it's a very positive buzz. It's an exciting time,
Hmm.
and lots of folks want to join us on that journey.
Thank you. And for those who are on this call and wondering whether or not they belong in this field as well, too, what advice would you give to them?
Well, you got to be about excellence. You got to be about hard work. You have to have kind of an infatigable kind of passion for the effort. But it is so rewarding to have that impact.
Mm.
Um, you young people are going to have an extraordinary journey and make a difference in the world. And there aren't a lot of people who do that, even though my kids are in business and finance and law. I think the biggest impact is helping communities that have been underserved heal and eliminate healthcare disparities. That's the greatest gift that we can give. Obviously, wealth and they're in legal and finance spaces. People have to be able to put food on the table.
Hmm.
But there are a few things that are more precious than your health. And we as providers can really make a difference. And particularly Black and brown folks, men and women, dedicated to that, it's a pretty cool thing. And so we see that in the statistics that we measure on a regular basis. If
Hmm.
you can reduce the gap of well-being between Michigan Avenue and 15 miles to the west, uh, the longevity of the people who we treat is matching those who have resources and affluent kind of access to healthcare. So that's a pretty special metric that we are thoughtful about, and but it's also providing access to great care.
Absolutely. Representation matters, and being able to see people who share your background, your story, and being able to advocate for them in these positions is really, really important too. To be able to ensure they have access to this care on so many different levels. I see a question in the chat from Miguel. He's asking, or they're asking, beyond scores, where do you see the strongest IMGs lose ground in the I6 CT surgery match?
Well, I think you have to have experience, potentially volunteer experience, so that you can demonstrate that not only do you have the academic and intellectual capabilities, but that you've demonstrated the passion for the work and commitment. Uh, um, that's really key. Community service, critically important in our application process, as well as great scores and scholarship. But volunteerism, doing it because you want to do it, not so much because it's going to help you get into school. I think people have to be passionate about that, and
Mhm.
it's got to be demonstrated in your essay, in your application in terms of your volunteer hours that you spend. Our medical students did close to 10,000 hours of volunteer service at Rush last year. Now, I mean, it's also the medical students and the nursing students and the College of Health Sciences students as part of a healthcare university. But many of our medical students are spending hours and hours and hours volunteering and trying to help those communities that are underserved. So if you can demonstrate that, as long as your academic aptitude and your test scores, I think it's a formula for success in terms of getting into healthcare and in particular cardiac. Now, you got to spend some time focusing on the general application, but also the cardiovascular medicine as an interest is distinguishes you as a healthcare provider who wants to do cardiovascular medicine.
I hope you guys are writing all these notes. I have a pen and paper here too, jotting all the great information being shared. Um, I have another question here as well. Dr. Robert Higgins, every step of your journey has felt relatable and encouraging. Thank you very much for your time and for sharing. Throughout your leadership career, you've mentored and supported countless trainees. From your perspective, what qualities make a faculty member feel confident enough to invest in their own reputation by writing an invitation letter or sponsorship for a young surgeon or researcher? Um, Beyond academic achievements, what truly earns your trust and advocacy?
I think at some point you have to, whoever your sponsors are or your mentors, you have to have some level of demonstration of your empathy, your work ethic, your commitment to the career. I graduated from medical school before I'm sure all of you were born, 1985. And then I had 5 years of general surgery training, and then 3 years of cardiac training, and a fellowship, a total of 9 years before I did my first case as an attending. So you've got to have some stick-to-itiveness. You've got to want to do it, and it's because it's going to take a period of time to get trained, particularly in cardiovascular. Now, not everybody wants to be a cardiovascular surgeon, and that probably makes sense. Um, but you've got to demonstrate the resolve to get the training and then be able to kind of fight the battle through the training to get to the point when you can be an attending. I think that is as important as your academic scores, your MCAT scores, your undergraduate scores, your essay, your ability to work hard for an extended period of time to achieve your goals. I think is critically important for you to somehow demonstrate either through your volunteer activities or your empathy as a provider, as a volunteer. Some way you've got to demonstrate that or have others who sponsor you recognize that as key attributes.
Perfect. Seems like your answer has been well received by the audience. I have another question here. So medicine is both deeply rewarding and incredibly demanding. What habits, routines, or perspectives have helped you remain resilient and purpose-driven throughout each of the different stages of your career?
I think you have to look out for your own well-being.
Mm.
It's easy to kind of be a workaholic and not take care of your emotional and your physical health. I try to work out at least 3 to 4 times a week. I set some boundaries. Well, actually, my wife sets the boundaries in terms of how much work we do on the weekend. We usually make sure that we have some time for personal growth and development, whether it be the arts or reading or exercise. We're fortunate to have our kids all in Chicago, so uh, we have kind of a date night, and we spend at least one night a week with our kids for dinner,
Mm.
and we don't do work stuff. And then I try to make sure that I don't do too much stuff on Sunday. I used to send a bunch of emails and do a bunch of business stuff and catch up and realize that folks need a day off. So whether it be either emotional support or church or exercise or golf or travel or just going on a walk, you got to take some time for yourself to kind of recharge your battery. So that Sunday is our day.
Got
And,
it.
and in fact, Saturday night, either it's a movie or it's a concert or it's spending time with our kids or it's reading, doing something to enrich our lives so that our mind isn't kind of always supercharging on this career aspect. And others would say, boy, you need more time than that to recharge your battery. But we've worked it out that that's kind of, I think you have to be mindful of that. I hope I can continue to, practice, for the next 5 years. Um, we are going to take some time to travel. And I am embarrassed to say that I've never taken a 2 week vacation.
Oh, wow.
Uh, I'm like, 2 weeks, what would I do? So maybe that's embarrassing for me to say, but we do make sure we spend time with our kids. So I do think you have to take some time away.
Got it. Self-care, boundaries, family, all very, very important things. I'm seeing a question from Dr. Henry here. Do you think individuals who go through the traditional pathway, Gen Surg instead of I6, are at a disadvantage applying or going into CT? Does being
No, you guys, boy, you guys are gunners.
does being cardiac focused?
Okay, so I
But
used to be I was the chair of the American Board of Thoracic Surgery exam committee for adult cardiac. And we looked at the I6 programs, the traditional 5-2 and 5-3 programs, and the 4-3 programs. And there's some subtle differences. My personal bias is that the folks who do general surgery for 5 years tend to learn how to manage teams, particularly when they become fourth and fifth year chief residents and they're rounding in the ICU or they're rounding on the trauma service or they're rounding in the cancer program. They learn how to take care of allied health professional teams of nurse practitioners and PAs and junior residents. Those who pursue the I6 program, the integrated six program, tend to be more focused on the procedural aspects coming right out of medical school. And we had some observations that the opportunities to develop as a team leader rather than a interventional specialist were different. Not saying that one was better than the other, but the I6 programs had people focusing on their procedural activities. They didn't have, rounding in the ICU as much, I don't think, as the trauma team did, or as the cancer team did, or as the general surgery, team. That was an observation that I made. Others may disagree with that. So depending on whether you want to be a proceduralist in cardiovascular medicine or interventional procedures, or a more general kind of, cardiovascular surgeon, uh, each pathway has its strengths and its weaknesses. I'm not saying that one is better than the other. I think they're just different. I did a 5 year general surgery, followed by a year in the lab, and then 2 years of cardiothoracic training, and then a fellowship. So that was at 9 years. But I loved every minute of it. It was so much fun. And quite frankly, now I stopped operating in December of 2024, and I miss it.
mm,
So I make rounds walking around in the ICU and sometimes oversee some donor work in our organ donor transplant center. But there's some days I say, why did I give up operating? And my kids all laugh and say, Dad, you're just a suit. But having an impact like in groups like this kind of makes it all worthwhile. So
absolutely. Thank you so much for your time. Dr. Henry, does that answer your question? I'm going to assume yes.
Well, again, it depends on what you're interested in. If you want to go into the procedural space and you want to do structural heart disease, the I6 may be the right place to go. We get catheter skills. If you want to be a transplant team leader, then maybe a more traditional 5-2 or 4-3 might
Hmm.
be something that you would want to pursue. Each one of them has their advantages and strengths and weaknesses.
Thank you. We have another question from Alma. As a medical student in Detroit, I've seen how patients from disadvantaged backgrounds often carry a much greater burden during recovery after major surgery. CT procedures can be life-saving, but the recovery is very physically demanding and often demands resources that not every patient may have. From your perspective, what can help support these patients through the immediate post-operative period?
That's a fantastic question. I would add that it was framed very clearly for me when I operated on. I had a bloodless cardiac surgery protocol at Henry Ford,
Hmm.
and a number of Jehovah's Witness patients who needed open heart surgery gravitated to my practice because I didn't offer them transfusion. As I would work diligently to try to operate on them when they needed open heart surgery and not transfuse them,
Hmm.
and really built a reputation for being a kind of a bloodless cardiac surgeon. But that created a significant amount of stress within our practice because not everybody saw that it was the right thing to do. As an example, many people who are on Medicaid, who are uninsured, but have cardiovascular disease or needed a lung operation or a open heart procedure, didn't have the resources that the majority community had. So the person who's bringing this to our attention is exactly right. We did create a program that had a safety net and ultimately provided resources for those patients, visiting nurse association, appropriate kind of perioperative and postoperative care to make sure that those patients got the care they deserved. And that's part of the leadership, but it's also part of the institutional commitment. We did have a very, very strong program at Henry Ford, which I was very proud of for that 6 years I was there, that dedicated its time and its energy for the convalescence for those patients who didn't have resources. So we had a food pantry, we had a visiting nurse program that they didn't have to pay for. We had
Hmm.
a number of other adjuncts to cardiovascular recovery that made a difference for those patients. And so I think assembling programs like that and being part of those programs is very rewarding. And but you have to kind of look for it. It doesn't always exist in some of the other programs that weren't mindful about that. But it's a great call out.
It definitely is. Thank you so much for that question, Ilma. I see another question here. So you've led both highly specialized surgical departments and large complex health systems. How does decision-making change when the stakes shift from individual patient outcomes to system-wide impact?
Wow, that's a great question. I think in the leadership role, you're often charged with making decisions for the greater good rather than for the individual patient, and I think it's informed by your experience. It really is a challenge, um, but my sense is that if I can create a healthcare environment at at Rush that supports the well-being of all of our patients, I can have a greater impact than the individual case by case application of care.
Hmm.
And so, as the chief clinical officer and the chief academic officer here, I can influence the care that we provide from cancer to neurosciences to cardiovascular, uh, and ultimately have a greater impact. Even though the individual impact is so powerful and important,
Yeah.
in the administrative role, I now have the ability to make our programs all stronger and the quality of our care even better. So I think one of the questions that's an extension of that question is, how do you transition from being an individual practitioner to being in the C-suite?
Yep.
And I think there's a bunch of people who have talent and ability who often gets called to serve in these administrative roles. I think one of the things you have to really understand is either as a department chair or a CEO or a dean is that you have to kind of prepare for that role. Different skill sets are necessary. They're often informed by really extraordinary experiences as a division head or a department chair, and then moving into the C-suite. I do think you probably can benefit from having some executive business training or leadership training. So after I got uh, my first division head role, I got a master's in health administration so I could learn how to run finance and budgets and contracts and conflict resolution, as well as uh, quality assurance programs.
Mm.
So I could be the complete leader, not just the cardiac surgeon. So you might have to get additional executive business or leadership training that helps prepare you to be a leader from a administrative perspective or a financial perspective. And so I think those are the kind of dimensions as you mature. Again, I did that after I was a division chief. That was I must have been, I don't know, 45 when I got my master's in health administration, almost 22 years ago. And it helped me be a better leader as well as being a better doctor. And I think that's what you probably have to be thinking about.
Thank you so much, Dr. Higgins. That was a very thorough answer, and it's such a unique opportunity to learn from you in that context as well, too. I'm seeing three more questions here in the chat. I'm going to work backwards just to
Sure.
a little bit better. So looking back, what are you most proud of that perhaps had nothing to do with an operation that you performed?
I think the things that I'm most proud of is number one, that I did over 5,000 open heart operations and or transplants, and that many of those patients benefited from my technical ability, but also the care that I provided, and they were very appreciative. Number two, I embraced the idea that my responsibility was to train the next generation of providers,
Mhm.
and many of the people who were my trainees, partners, proteges are now and continue to be successful providers. So my impact has been not just those 5,000 patients, but all those people who are doing 5,000 cases
Absolutely.
as well.
Yeah.
So the kind of the impact factor has been the growth of a network of people who I somehow influenced and or helped to grow and to develop. And I think ultimately the most satisfying piece of it is that I have been fortunate to work in great environments where we have a mutually beneficial, great relationship, and this getting back to that servant leadership thing, I feel like I'm here to make a difference and help other people succeed. And when they do, I have a point of pride that's, you can't put a price on that. Just like all of you, if any of you kind of thrive and get some pearls of wisdom and then go on to be cardiothoracic surgeons and take care of patients and have a successful career, I will feel some small piece of the pie I contributed to maybe I helped. And if that is true, and don't tell me if it's not, just say that it is. But if in fact it is true, then I will have accomplished something pretty cool.
Thank you so much for pouring into all of us, even during this call, and all the people that you've inspired throughout your career. I'm pretty sure they're very thankful and very much inspired by your presence and your pursuit of excellence, especially when it comes to compassionate care. Um, we have another question from Maggie. Speaking of transplants, what do you think are the major gaps, opportunities, and next innovations in heart and lung transplant, both medically and ethically?
Well, the biggest challenges, of course, is there aren't enough replacement hearts or innovative operations to serve the communities that are desperately in need. Cardiovascular illness and disease are still the number one reason why people die in the Western world.
Yeah.
Now, that's the Western world. In other remote environments, Asia, Africa, there's a different epidemiologic and public health set of crises that we should be addressing as well. But if you are interested in cardiovascular well-being, we still have a long way to go. And so we need everybody on this call to dedicate themselves to trying to help us solve some of those problems, whether it be in pediatrics or in internal medicine or in public health or in surgical disciplines or even administration of cardiovascular spaces. We need all hands on deck to try to, save as many people as possible. So I think that's the challenge. Again, stroke, heart attack,
Yeah.
heart failure, obesity-related activities, endocarditis. In sub-Saharan Africa, the most common reason why people die is endocarditis,
Yeah.
ironically, and infectious complications of cardiovascular disease. So it's important to kind of think about our overall epidemiologic kind of challenges if you want to be a healthcare provider and try to figure out how we can uh, change the world accordingly. So I think that would be a big impact if we had more talented young people like you folks who pursued the careers and made a difference. That would save a ton of lives.
Millions, actually. So many. Um, we have another question from Alvaro. So, Dr. Higgins, I would love to ask you if you had any tips for international medical students who are interested in getting into CT surgery in the US.
Well, I do think I've said some of these things.
Mhm.
Um, Many of them don't require academic talent or test scores. They're basic kind of life skills. Things like your work ethic, your effort,
Mhm.
how you interact with others, your energy, your attitude, your commitment to the healthcare initiatives that you champion. I think you also have to be coachable.
That's true.
Uh, you have to kind of be prepared to go the extra distance and do the extra in order to be successful. Those are all attributes that don't require much talent or intellect. They're all about applying yourself to achieve your goals. So I don't want to be too soapy about it, but half of the battle is marshaling those resources and those strengths to accomplish your goal. I think that's applicable for cardiac. So I really hope that you kind of commit those things to your passion for this pursuit in medicine, and hopefully it'll make a difference. But many of those things are not because you have resources or that you've got a superstar IQ. They're about effort, hard work, commitment, and passion for having an impact. Because I certainly am not the smartest guy in this call, but if I apply all those other skills that I have, I got a fighting chance of making a difference.
Absolutely. I have another question here from Delia. Dr. Higgins, I really appreciate hearing you talk about continuing your education after you are well into your career. How do you think young surgeons should approach lifelong learning once they are immersed in the demands of residency and practice?
Well, we have to be students of our craft, and you have to be a lifelong learner.
Mhm.
There are things that I've learned about the things that I'm passionate about that I might not have mastered before this. And yet it's hard to kind of maintain that commitment. You assume, okay, I'm tired after 9 or 10 years of training. I want to kind of sit back and reap the fruits of my labor. But in fact, I think you have to stay motivated because the field is changing. There are things that I did 25 years ago, which are kind of outdated now in the field of cardiovascular and thoracic surgery. So the modern techniques are different, robotics, mitral repair, other things that uh, young surgeons now master, which I never learned about or practiced. So you have to be able to stay conversant with whatever is evolving in terms of the field, whether it be cancer care or neurosciences or cardiovascular. You've got to be able to apply those things as new information becomes available. And I think that's the reason why they say you got to be a lifelong learner because the field changes. It's much different now than it was when I was a fellow in 1993.
Got it. And I guess following up to that question, you've worked across several of the most prestigious academic institutions in the country. What have you learned about institutional culture that makes a place a great place to train and work beyond the resources or the reputation?
I think you could assume that culture is going to, you've heard this before,
Mhm.
um, overcome strategy uh, all the time. The
Okay.
culture that you find yourself either learning in or practicing in or being cared for often determines your success and your failure. It's hard to find places that welcome you and want you to be there, but that's what we all want. And so finding great places, I'm fortunate to be back at a place like Rush, where I'm welcomed here as a leader, but also a provider and somebody who may have an impact. So you want to try to find that niche, that culture that welcomes you, whether you're a man or a woman, person of color, a person of diverse backgrounds. Finding the right place where you can become a member of the team, as it were, and be welcomed, critically important to your success as a provider. So sometimes that's hard to do. Uh, Sometimes there's some trial and error involved. So I do think that there's no guarantees, but I've been lucky to go to some really great places. I also think you got to be kind of resilient. You got to have kind of a thick skin. You got to take some adversity as part of the plan. It's not always going to be milk and honey,
That's true.
and so you really got to be able to be resilient and take some BS sometimes. Um, and that's hard because you don't always say, "Well, nobody told me it was going to be this hard." Well, nobody guaranteed you it's going to be that easy. So I think, without getting over dramatic about it, you just got to be kind of resilient and you got to say, okay, I'm learning, I'm living and hopefully excelling in the space that you're in and measure your success by the people you serve and you take care of.
Hmm. Measure success by the people you serve and take care of. I hope you guys are taking notes of these quotes. They're really profound. Um, we do have one final question for you, Dr. Higgins. On this call, we have high school students like Maria Escalante. We have medical students like Danielle. We also have residents like Dr. Henry. When you think about the next generation of physicians in front of you today, what gives you the most optimism and what words of wisdom would you want to leave them with at the end of this call?
Wow, I'm optimistic because of all of you. It's near 7 o'clock on a call, probably doing something cool. You could have been doing something otherwise, that you're taking the time to listen to an old guy, what talk about his career. So I think that means something. So I think that the rooms that I inhabit are full of young people like you. I'm also encouraged by the optimism and the interest that we have in our academic environment. And I think it's probably reflective of what's going on across the country. Now, we have thousands of applicants for a relatively small number of spots
Hmm.
in our medical school. And my bias is I think that the interest in healthcare is at a very high level, maybe an all-time high, even though there are incredible challenges and obstacles that are in the healthcare environment. So it gives me some hope that because you guys are mission driven and want to make a difference, that there's an opportunity for us to do some good stuff. And I'm optimistic that with your generation's kind of commitment to the future, it's pretty cool. And we've got a great reason to be hopeful for what your generation can do to help uh, serve the greater good. I think that from a leadership perspective, my responsibility, this is obviously, I think somebody, I'm trying to remember who said this, Maxwell or somebody, that my job is not because I have some great influence over you, but if I can help you succeed in your journey, then I have accomplished something really extraordinary. That's my responsibility. I think there's a whole bunch of people out there from my generation who feel like they should be reaching back and helping you guys succeed. And that's pretty cool. So I'm hopeful that kind of some of this conversation will empower you or inspire you or help you kind of on your journey. And if we do that, if one person succeeds because of something they heard or thought about on this call, well, then we've accomplished something pretty cool. So I appreciate the opportunity to spend time with you guys, um, and encourage you to persevere and to work hard. It is worth the effort. It is worth the effort. Not easy, but certainly worth the effort.
Absolutely. Dr. Higgins, on behalf of TSMA and everyone who has joined us this evening, thank you so much for sharing your journey, your leadership lessons, your resilience, and your thoughtful words of wisdom. Your commitment to excellent service and mentoring future physicians is truly inspiring and felt by everyone in this room as well as virtually. And so we're very grateful for your generosity and being able to invest your time in the next generation. So
Well,
thank
it's just I really appreciate it. Who knows? One of you guys may be taking care of me someday. Oh, there is some self-interest there. Having the next cohort of doctors be great doctors, there is some. This is it may help me somewhere down the line. So that's not the reason to say thanks, but I appreciate it anyway. Cool.
All right. Thank you so much. And again, to everyone, please stay connected to TSMA as we continue to host more programs. This actually concludes our final and last NextGen Heart session. And so we're so grateful for all of you guys who've been consistent in joining us every month. So please feel free to watch our recordings, which are uploaded to YouTube. Thank you so much again. We really do hope you have a wonderful evening. So thank you.
Hey, congratulations, everybody. Keep doing good things. Thank you. Thanks,
Thank,
Nina, and thank you for your leadership.
absolutely. Thank you. Truly.
Inspiring as well. Take care.
Bye, everyone.
Bye.